let us discuss about class 3 of the CPC training course. In the current session, we will be discussing the basics of anatomy of cardiovascular system, which is nothing but CVS. And this will be available in the playlist CPC training course. In the current session, we will be discussing what are the layers of the heart, different chambers of the heart, various valves of the heart, what is coronary circulation, what is the difference between pulmonary and systemic circulation, and what is the conduction system of the heart, and finally at the end of each topic you can find clinical significance. Clinical significance is nothing but we will discuss few pathologies associated with this anatomical structure. Now coming to the introduction of cardiovascular system. The cardiovascular system consists of blood, the heart and the blood vessels. The cardiovascular system is composed of, in simple terms, heart and blood vessels. For blood to reach each body cells and exchange materials with them, it must be pumped continuously. For the blood to reach each body organ, it must be pumped continuously by the heart through the body's blood vessels. And the right side of the heart pumps blood through the lungs, enabling blood to pick up oxygen and unload carbon dioxide. For that reason, the right side of the heart contains deoxygenated blood. The right side of the heart pumps blood through the lungs, enabling the blood to pick up oxygen and unload carbon dioxide. Even when you are sleeping, your heart pumps 30 times its own weight each minute, which amounts to about 5 liters to the lungs and same volume to the rest of the body. At this rate, your heart pumps more than about 14,000 liters of blood in a day or 5 million liters in a year. And the scientific study of normal heart and the diseases associated with it is called as cardiology. Cardio means heart, logy means study of. Now coming to the location of the heart. Where does the heart lie? The heart rests on the diaphragm. Diaphragm is a skeletal muscle that separates the thoracic cavity from the abdominal cavity. The heart rests on the diaphragm near the midline of the thoracic cavity and it lies in the mediastinum. Heart lies in the mediastinum. The correct location is mediastinum. What is mediastinum? It is an anatomical region that extends from the sternum to the vertebral column, from the first rib to the diaphragm between the lungs. And about two-thirds of the mass of the heart lies to the left of the body's midline. And the pointed apex, the apex of the heart is formed by the tip of the right ventricle. Apex of the heart is formed by the tip of the left ventricle. The apex of the heart is formed by the tip of the left ventricle and rests on the diaphragm. And it is directed anteriorly, inferiorly and to the left. And the base of the heart is opposite to the apex and it is the posterior aspect. Base is formed by atria, which are nothing but the upper chambers of the heart and mostly the left atrium. So left ventricle forms the apex. In simple terms, left ventricle forms the apex of the heart and left atrium forms the base of the heart. Apart from apex and base, heart has various surfaces. They are the anterior surface, inferior surface, right surface and left surface. The anterior surface of heart is deep to sternum and ribs. And the inferior surface is the part of the heart between the apex and the right surface. Between the apex and the right surface is the inferior surface. Inferior surface of the heart is between the apex and the right surface. This is the apex and this is the right surface. So this is the inferior surface. Inferior surface is the part of the heart between the apex and the right surface and rests mostly on the diaphragm. So which surface of the heart on the diaphragm. The inferior surface of the heart rests on the diaphragm. Next, coming to right surface. The right surface faces the right lung and extends from the inferior surface to the base. The right surface extends from the inferior surface to the base. And the left surface faces the left lung. Right surface faces the right lung and left surface faces the left lung and extends from the base to the apex. So these are the various surfaces of the heart. Next, coming to pericardium. What is pericardium? The membrane that surrounds and protects the heart. The membrane that surrounds and protects the heart is called as pericardium. Peri means around, cardium means heart. So pericardium is the membrane that surrounds and protects the heart. It is mainly composed of two layers, fibrous pericardium and serous pericardium. And the pericardium confines the heart to its position in the mediastinum while allowing sufficient freedom of movement for rigorous and rapid contractions. So pericardium allows the heart to move freely during rigorous and rapid contractions. Here you can see this is the pericardial cavity. So this pericardium encloses the heart. It has two layers, fibrous pericardium and the serous pericardium. Inner layer is the visceral layer of the serous pericardium. Here you can see this serous pericardium is again divided into visceral layer and parietal layer that we will discuss in the next slide. So heart is enclosed by pericardium. Pericardium is the membrane that surrounds and protects the heart, and it confines the heart to its position in the mediastinum while allowing sufficient freedom of movement for rigorous and rapid contractions. As we have discussed earlier, pericardium is composed of two layers, fibrous pericardium and serous pericardium. Fibrous pericardium is the superficial, tough, inelastic, dense connective tissue. What are the functions of fibrous pericardium? It prevents overstretching, provides protection and anchors the heart in the mediastinum. Next, coming to the inner layer of pericardium, that is serous pericardium. It is a thinner, more delicate membrane that forms double layer around the heart. So serous pericardium is again divided into parietal layer and visceral layer. The parietal layer of serous pericardium is fused with fibrous pericardium. The parietal layer of the serous pericardium is fused with the fibrous pericardium. And next layer is the inner visceral layer of the serous pericardium is also called as epicardium. So which part of the heart is both a part of pericardium and heart? The part of the heart which is both part of pericardium and heart is epicardium. Epicardium is the outer layer of the heart, and that is also the inner visceral layer of the serous pericardium. The inner visceral layer of the serous pericardium is also called as epicardium. So epicardium is the link between the pericardium and the heart. Now, between the parietal and the visceral layers of the serous pericardium, the serous pericardium is divided into parietal and visceral layers. The inner visceral layer is nothing but the epicardium. And between the visceral and parietal layers of the serous pericardium is a thin film of lubricating serous fluid. And that fluid is called as pericardial fluid, and it is secreted by pericardial cells. The function of pericardial fluid is to reduce the friction between the layers of the serous pericardium as the heart moves, and the space or the cavity that contains the pericardial fluid is called as pericardial cavity. Now coming to the clinical significance. What is the clinical significance of pericardium? It protects the heart. And whenever there is an inflammation of pericardium, pericarditis occurs. The inflammation of the pericardium is called as pericarditis. It is the most common type of pericarditis is acute pericarditis. The pericarditis can be of two types, acute and chronic. The most common type is acute pericarditis. It begins suddenly and has no known cause in most of the cases, but in sometimes it is linked to a viral infection. As a result of the irritation of pericardium, there is a chest pain that may extend to left shoulder down the left arm and often mistaken to heart attack. So the pain that is associated with pericarditis is often mistaken to a heart attack. The uncommon type is chronic pericarditis. It begins gradually and is long lasting. In one form of this condition, there is a buildup of pericardial fluid. In chronic pericarditis, in addition to the inflammation, there is a buildup of pericardial fluid. And whenever a great amount of fluid accumulates, this can lead to a life-threatening condition because the fluid that has been built up, it compresses the heart and it leads to a condition called as cardiac tamponade. So chronic pericarditis can lead to cardiac tamponade. Pericarditis is nothing but inflammation of pericardium. It can be of two types, acute and chronic. Acute is the most common type and is associated with a viral infection. Whereas chronic pericarditis can be life-threatening as it may lead to cardiac tamponade. Now coming to layers of the heart. There are mainly three layers of the heart. Now coming to the layers of the heart wall, in specific heart wall. Heart wall is mainly composed of three layers, epicardium, myocardium and endocardium. Epicardium is the outer layer of the heart, whereas myocardium is the middle layer and endocardium is the inner layer. Epicardium itself is composed of two layers. The outer layer of the epicardium is nothing but the visceral layer of the serous peritoneum. The outer layer of the epicardium is nothing but the visceral layer of the serous peritoneum, and it has an inner fibroelastic and adipose tissue. Below that serous pericardium is the inner elastic, fibroelastic and adipose tissue. What is the function of epicardium? It mainly houses the blood vessels and lymphatics that supply the myocardium. That is the major function of the epicardium. Next, coming to the middle layer, which is nothing but myocardium. And myocardium, it contributes for 95% of the wall of the heart. So the major layer of the wall of the heart is myocardium. It is the major layer and it is the main layer that is responsible for pumping action of the heart. Which layer of the heart is responsible for the pumping action? Myocardium. Myocardium is responsible for pumping action of the heart and is composed of cardiac muscle tissue. Coming to inner layer, which is nothing but endocardium. It is continuous with the endothelial lining of the large blood vessels. Here you have an L here, endothelial, L-I-A-L. Endothelial lining of the large blood vessels and attaches to the heart. What is the function of endocardium, inner endocardium? It provides the smooth muscle lining for the chambers of the heart and covers the valves of the heart. The layer that covers the valves of the heart is endocardium. The layer that is responsible for pumping action is myocardium. The layer that houses the blood vessels and lymphatic that supply the myocardium is epicardium. So these are the three layers of the heart wall, to be specific. Now coming to the clinical significance. Previously we have discussed pericarditis. Now let us discuss about what is myocarditis and what is endocarditis. As the name indicates, myocarditis is nothing but inflammation of the myocardium. Itis is inflammation. Myocardium. Myocarditis is inflammation of the myocardium that usually occurs as a complication of viral infection rheumatic fever, or exposure to radiation or certain chemicals or medications. And myocarditis often has no symptoms. However, if if they do occur, they may include fever, fatigue, vague chest pain, irregular and rapid heartbeat, joint pain, and breathlessness. And myocarditis is usually mild and recovery occurs within 2 weeks. Severe cases can lead to cardiac failure and death also. Treatment of myocarditis, it mainly consists of avoiding rigorous exercise, a low salt diet, electrocardiographic monitoring, and the treatment of the cardiac failure in severe cases. Next, coming to endocarditis. Endocarditis, as the name indicates, it is an inflammation of the endocardium and it typically involves heart valves. And most cases are caused by bacteria. The common name is bacterial endocarditis. The signs and symptoms of the endocarditis include fever, heart murmur, irregular or rapid heartbeat, fatigue, loss of appetite, night sweats and chills. And the treatment for endocarditis is intravenous antibiotics. Now coming to chambers of the heart. The heart is mainly composed of 4 chambers. 2 superior receiving chambers which are called as atria that receive blood from the veins, and 2 inferior pumping chambers called as ventricles that pump the blood into artery. So what are the pumping chambers? Ventricles are the pumping chambers. What are the receiving chambers? Atria are the receiving chambers. Veins always carry blood towards the heart. Remember one point, veins. It can be any vein. It carries the blood towards the heart. Whereas arteries, they carry the blood away from the heart. Artery is nothing but blood vessel. So it carries blood away from the heart. Veins, they carry blood towards the heart. First of all, coming to atria. On the anterior surface of each atrium is a wrinkled pouch-like structure called as auricle. So what is auricle? It is a wrinkled pouch-like structure on the anterior surface of each atrium. There are 2 auricles. It is so named because of the resemblance of a dog's ear. And each auricle, what is the function of auricle? Each auricle slightly increases the capacity of an atrium so that it can hold a greater volume of blood. And on the surface of the heart are a series of grooves called as sulcus that contain coronary blood vessels and variable amount of fat. What are sulcus? They are a series of grooves. And what is the function of sulcus? Each sulcus marks the external boundary between the 2 chambers of the heart. Any 2 chambers. Each sulcus marks an external boundary between the 2 chambers of the heart. And there are mainly 3 sulcus: coronary sulcus, anterior interventricular sulcus, posterior interventricular sulcus. The coronary sulcus, it forms an external boundary between atria and ventricles. Whereas anterior interventricular sulcus, as the name indicates, it forms an external boundary between the right and left ventricle. Interventricular, between the right and left ventricle on the anterior side. Hence the term anterior interventricular sulcus. The next is posterior interventricular sulcus. It forms an external boundary between the right and left ventricle on the posterior side. Now coming to right atrium in specific. This is our right atrium. This part is the right atrium. Remember, the right side of the heart contains deoxygenated blood. Hence it is indicated by blue color. The right atrium forms the right surface of the heart and receives blood from 3 veins. Right atrium receives blood from 3 veins. What are they? Superior vena cava. This is superior vena cava. Inferior vena cava, IVC. Superior vena cava, SVC. inferior vena cava IVC, and coronary sinus. Right atrium forms the right side of the heart and receives the blood from three veins: superior vena cava, inferior vena cava, and coronary sinus. As we have discussed earlier, veins always carry blood towards the heart, and the blood passes from the right atrium into right ventricle through a valve called as tricuspid valve. The blood passes from the right atrium into the right ventricle through a valve called as tricuspid valve. Tricuspid valve. It indicates three cusps. Remember RTC for the location of the heart. Right atrium. The valve between right atrium and right ventricle is tricuspid valve. The name indicates tricuspid because it has three cusps. Because it consists of three cusps or leaflets, and it is also called as right atrioventricular valve. So what is the right atrioventricular valve? Tricuspid valve is also called as right atrioventricular valve. Remember RTC. R for right side, right atrium to right ventricle has tricuspid valve. TC, RTC. And the right atrium forms the right surface of the heart and receives blood from three veins: superior vena cava, inferior vena cava, and coronary sinus. Now coming to right ventricle. So here you can see this part is the right ventricle. And internally the right ventricle is separated from the left ventricle by a partition called as interventricular septum. Any septum, interauricular septum or interventricular septum, it divides into right and left side. For example, nasal septum also divides the nasal cavity into right side and left side. So interventricular septum is a partition between the right and the left ventricle. This thing is the interventricular septum. And the important point in the right ventricle is, the first point is the blood flows from the right atrium. This is the right atrium, the grey color one. The blood flows from the right atrium into right ventricle through tricuspid valve. 1, 2, 3. Remember, this is the tricuspid valve. Here the valve is open. The blood flows from right atrium into right ventricle through tricuspid valve. And the blood passes from the left ventricle through pulmonary valve. There is one more valve, pulmonary valve. This is the pulmonary valve that is in the left ventricle. The blood passes from the pulmonary valve through the right ventricle through pulmonary valve into large artery called as pulmonary trunk. This is the pulmonary valve and this is a semilunar valve. Pulmonary valve and aortic valve are called as semilunar valves. The blood passes from the right ventricle into a larger artery called as pulmonary trunk through pulmonary valve. And this pulmonary trunk divides into right pulmonary artery and the left pulmonary artery. This is the trunk. It divides into left pulmonary artery, and here you can see this is the right pulmonary artery that carry the blood to the lungs. Arteries always take blood away from the heart. Arteries away. Remember, arteries away. Arteries always take blood away from the heart. Next, coming to left atrium. We have discussed about right atrium, right ventricle. Now we are discussing about left atrium. Left side of the heart always contains oxygenated blood. Hence it is indicated by red color. So this is the left atrium. The left atrium is about the same thickness as the right atrium and forms most of the base of the heart. The base of the heart is formed by left atrium, whereas the apex of the heart is formed by left ventricle. And the left atrium receives blood from the lung through 4 pulmonary veins. The left atrium receives the blood from the lungs through 4 pulmonary veins. 2 left pulmonary veins and 2 right pulmonary veins. In total, 4 veins. 4 pulmonary veins. The function of left atrium is it receives blood from the 4 pulmonary veins. They are nothing but 2 left pulmonary veins and 2 right pulmonary veins. This is the left atrium. These are the left pulmonary veins and these are the right pulmonary veins. And the blood passes from the left atrium into left ventricle through bicuspid valve. It passes from the right atrium into right ventricle through tricuspid valve. For that, you have to remember RTC. And when it comes to left atrium, the blood passes from the left atrium. This is the left atrium. The blood passes from the left atrium into the left ventricle through bicuspid or mitral valve. Remember, left side LM, left side mitral valve, right side tricuspid valve. Mitral valve is also called as bicuspid valve because it has two cusps. The blood passes from the left atrium into the left ventricle through bicuspid or mitral valve, which, as its name indicates or implies, has two cusps. And the term mitral refers to the resemblance of the bicuspid valve to Bishop's mitre, that is nothing but hat, which is a two-sided. It is also called as left atrioventricular valve. The left atrioventricular valve is the bicuspid valve and the right atrioventricular valve is the tricuspid valve. And the bicuspid valve is also called as mitral valve, which allows the blood to flow from left atrium to left ventricle. Now coming to left ventricle. So which is the thickest chamber of the heart and which is the most working chamber of the heart? In both the cases, the answer is left ventricle. The left ventricle is the thickest chamber and it is the most working chamber of the heart. The thickness averages from 10 to 15 mm or 0.4 to 0.6 inches and it forms the apex of the heart. Left ventricle forms the apex of the heart. This is the left ventricle. This is the thickest chamber of the heart. Now the blood passes from the left ventricle through the aortic valve. Till now we have discussed all 4 valves. What are all 4 valves? First is tricuspid valve, which allows the blood to flow from right atrium into right ventricle. Right atrium into right ventricle, that is the tricuspid valve. Here you can see this is the tricuspid valve. The next is bicuspid valve. It allows the blood to flow from left atrium into left ventricle. And the next valve what we have discussed is pulmonary valve. It allows the blood to flow from right ventricle. The pulmonary valve allows the blood to flow from right ventricle into a large pulmonary artery called as pulmonary trunk. And finally coming to aortic valve. Through the aortic valve, the blood passes from the left ventricle into ascending aorta. This is the ascending aorta and this is the aortic valve. With the help of aortic valve, the blood flows from left ventricle into the ascending aorta. And some of the blood in the aorta flows into coronary arteries, which branch from the ascending aorta and carry the blood to heart. This ascending aorta is responsible for the coronary circulation. Some of the branches of ascending aorta carry the blood to heart wall. And the remainder of the blood passes into arch of aorta. This is in the form of an arch. Hence the name arch of aorta. Arch of aorta. There are 3 branches of aorta. Ascending aorta, arch of aorta and descending aorta. Here you can see descending aorta. So the remainder of the blood passes into the arch of aorta and descending aorta. And the branches of the arch of aorta and descending aorta carry the blood throughout the body. By that we complete the chambers of the heart. Now we have discussed the structures. Now we'll discuss about the circulation. So first circulation is coronary circulation. As we have discussed earlier, the ascending aorta, the branches of ascending aorta supply the coronary arteries. So coronary arteries, they compose the coronary circulation. What is coronary circulation? The myocardium itself has a own mesh or network of blood vessels. That is nothing but coronary circulation. The coronary circulation is composed of coronary arteries and coronary veins. The coronary arteries branch from the ascending aorta and encircle the heart like a crown encircles the head. Hence the name coronary. And when the heart is contracting, little blood flows in the coronary arteries because they are squeezed shut. And when the heart relaxes, high pressure of the blood in the aorta propels blood through the coronary arteries into capillaries and then into veins. So when heart is contracting, little blood flows in the coronary arteries. Coronary circulation is made up of coronary arteries and coronary veins. We'll briefly discuss the names of the coronary arteries and coronary veins. One more important point in the coronary circulation is anastomosis. What are anastomosis? Usually, most parts of the body receive blood from branches of more than one artery. Most parts of the body, they receive the blood from branches of more than one artery. And when two or more arteries supply the same region, please remember this point, when two or more arteries supply the same region, they usually connect. And these connections of those two arteries are called as anastomosis. That is a singular term. Anastomosis is nothing but a place where two arteries connect and they provide an alternate route called as collateral circulation. So what are responsible for the collateral circulation? Anastomosis are responsible for the collateral circulation. And the myocardium contains many such kind of anastomosis. Thus, heart muscles may receive sufficient oxygen even if one of its coronary arteries is partially blocked. This is the reason why the myocardium or the heart muscles receive sufficient oxygen even if one of its coronary arteries are partially blocked. Now coming to coronary arteries are mainly, ascending aorta is mainly divided into right coronary artery and left coronary artery. The right coronary artery is again branched into posterior interventricular branch and marginal branch, whereas the left coronary artery is divided into anterior interventricular branch or left anterior descending artery (LAD) and circumflex branch. These are the branches of left coronary artery and these two are the branches of right coronary artery. As of now, let us only see the names. Now coming to coronary veins. After the blood passes through the arteries of the coronary circulation, it flows into arterioles and then into capillaries. Here we did not mention the term arterioles. Remember, the blood flows from arteries into arterioles and then into capillaries. Capillaries are the place where it delivers the oxygen and nutrients to the heart muscle and collects the carbon dioxide and waste and moves into coronary venules. From arteries, it flows into venules and from veins, it forms into coronary veins. Venules into veins. And most of the deoxygenated blood from myocardium drains into a large vascular sinus in the coronary sulcus that we have discussed earlier. The right atrium receives blood from three veins: coronary sulcus, superior vena cava and inferior vena cava. Most of the deoxygenated blood from the myocardium drains into a large vascular sinus in the coronary sulcus on the posterior surface of the heart called as coronary sinus. What is a vascular sinus? Vascular sinus is a thin-walled vein. Vascular sinus is a thin-walled vein that has no smooth muscle to alter its diameter. And the deoxygenated blood in the coronary sinus empties into right atrium. From this coronary sinus, the blood is emptied into right atrium. Now coming to the coronary veins, there are mainly 4 coronary veins: great cardiac vein, middle cardiac vein, small cardiac vein and anterior cardiac vein. The great cardiac vein is located in the anterior interventricular sulcus and middle cardiac vein is located in the posterior interventricular sulcus and small cardiac vein is located in the coronary sulcus. Here you can see the pictorial representation of coronary arteries and coronary veins. The left and right coronary arteries deliver blood to heart and the coronary veins drain blood from the heart into the coronary sinus. Here you can see this is the left coronary artery, and this one is the right coronary artery. It is its marginal branch, and this one is the posterior interventricular branch, and this one is the anterior interventricular branch, and here you can see this is the circumflex branch. These are the arteries, view of coronary arteries, and here you can see these are the veins. This is the great cardiac vein, this one is the middle cardiac vein, and this thing is the anterior cardiac vein, and this one is the small cardiac vein. Now let us see level 2 HCPCS modifiers. As of now, those who don't know what is medical coding, they may not be familiar with level 2 HCPCS modifiers. But because we have discussed about the coronary arteries, I would like to mention these are the modifiers. LC modifier is indicated to indicate left circumflex coronary artery. LD is indicated for left anterior descending coronary artery. LM is indicated for left main coronary artery. And RC is indicated for right coronary artery. And RI is indicated for ramus intermedius coronary artery. Whenever procedures are performed on the coronary arteries, along with the procedure CPT, this respective modifier is appended to indicate the type, which type of artery it is performed. For example, with some CPT, RC modifier is appended. It indicates the procedure is performed on right coronary artery. This is just for information sake. We will discuss about this when we talk about the modifiers topic. So these are the 5 level 2 HCPCS modifiers that are used to indicate the type of coronary artery. Now coming to clinical significance. Here we will be discussing few pathologies. Now we have discussed about the blood circulation. Partial obstruction of blood flow. The partial obstruction of blood flow in the coronary arteries can cause myocardial ischemia. Ischemia is nothing but obstruction to blood flow. Obstruction to blood flow. ISCHE. Ischemia means to obstruct. Emia is related to blood. So ischemia is obstruction to blood flow. Partial obstruction of blood flow in the coronary arteries can cause myocardial ischemia. It is a condition where reduced blood flow to myocardium occurs. Because there is an obstruction to the flow, it leads to reduced blood flow. And this reduced blood flow leads to hypoxia. Usually, ischemia causes hypoxia. Hypoxia is nothing but reduced oxygen supply, which may weaken the cells without killing them. The next condition is angina pectoris. Angina pectoris is literally means strangled chest. Angina pectoris is a symptom. It is a severe pain that usually accompanies myocardial ischemia. Angina pectoris is a severe pain that usually accompanies myocardial ischemia, and typically the sufferers describe it as tightness or squeezing sensation in the chest. Hence the name strangled chest. And the pain associated with angina pectoris is often referred to neck, chin and down the left arm to the elbow. The next case is silent myocardial ischemia. Ischemia episodes without pain. Silent means without pain is particularly dangerous because the person has no forewarning of an impending heart attack. And partial obstruction leads to myocardial ischemia, whereas complete obstruction, a complete obstruction to blood flow in the coronary artery may result in myocardial infarction. Infarction is nothing but death. A complete obstruction of the blood flow leads to cell death, which is nothing but myocardial infarction, MI. It is commonly called as MI, or more commonly heart attack. The infarction means death of an area of the tissue because of interrupted blood supply. And because the heart tissue that is distal to the obstruction, that is next to the obstruction, dies, it is replaced by a non-contractile scar tissue and the heart muscle loses some of its strength. And depending upon the size and location of the infarcted area, an infarction may disrupt the conduction system of the heart and cause sudden death. Myocardial infarction can disrupt the conduction system of the heart and cause sudden death by triggering ventricular fibrillation. And the treatment for myocardial infarction involves injection of an thrombolytic, that is clot dissolving drug such as streptokinase or tissue plasminogen activator, TPA, plus heparin, which is nothing but anticoagulant, or performing a coronary angioplasty or coronary artery bypass grafting. And fortunately, heart muscle can remain alive. Fortunately, the heart muscle can remain alive in a resting person if it receives as little as 10 to 15% of the normal blood supply. Even though the blood supply is very low, 10 to 15 supply is also sufficient to make the heart muscle alive in a resting person, not in an active person. Heart muscle can remain alive in a resting person if it receives as little as 10 to 15% of its normal blood supply. Now we have discussed the coronary circulation, that is the blood supply to heart. But this heart is the pumping reservoir to supply blood to all body parts. So the cardiac circulation within the heart, with the help of the heart, there are two types of circulations: pulmonary circulation and systemic circulation. The right side of the heart is the pump for pulmonary circulation. The right side of the heart is the pump for pulmonary circulation. Pulmonary means related to lungs. Pulmonary circulation is related to blood supply to lungs. And systemic circulation. The left side of the heart is the pump for systemic circulation. Systemic circulation is related to blood supply to all different body parts except lungs. Now here you can see the entire representation of both pulmonary circulation and systemic circulation. The left side of the heart pumps oxygenated blood. Previously we have discussed that the left side of the heart contains oxygenated blood and the right side of the heart contains deoxygenated blood. The left side is indicated by red color and right side is indicated by blue color. The left side of the heart pumps the oxygenated blood into the systemic circulation to all tissues of the body except the air sacs of the lungs. And the right side of the heart pumps deoxygenated blood into pulmonary circulation. So what is the first step? There is no first step, it is a cycle. As of now, here it is indicated as step 1. So we'll go from numerical order. We'll go in a numerical order. The first is right atrium. Right atrium receives deoxygenated blood. Various body parts from superior vena cava, inferior vena cava and coronary sinus. The right atrium receives the deoxygenated blood. That is the first step. Next, through tricuspid valve. We have discussed earlier, through tricuspid valve, the blood flows from right atrium into right ventricle. And through the pulmonary valve, the blood flows from right ventricle into pulmonary trunk, which is branched into pulmonary arteries. Through the pulmonary valve, the blood flows from right ventricle into the pulmonary trunk, and this pulmonary trunk is divided into pulmonary arteries. Right pulmonary artery and left pulmonary artery, they supply the deoxygenated blood to lungs. So this is the pulmonary circulation. So in pulmonary capillaries, blood loses carbon dioxide and gains oxygen. This is the right side of the heart. And oxygenated blood, the pulmonary veins. Pulmonary veins contain oxygenated blood. The pulmonary veins contain oxygenated blood, and from the pulmonary veins, the oxygenated blood flows into left atrium. The left atrium receives blood from 4 pulmonary veins. We have discussed earlier. The left atrium receives blood from 4 pulmonary veins, to right, to left. So the pulmonary veins, they pump blood into left atrium. And from left atrium, the oxygenated blood flows into left ventricle through bicuspid valve. It is also called as mitral valve. Remember LM. And for right side, it is RTC. So from left atrium, through the bicuspid valve, it flows into left ventricle. And from the left ventricle, it flows into aorta through aortic valve. The oxygenated blood flows from left ventricle into aorta through aortic valve. And this aorta, it forms arteries, systemic arteries, and these arteries form arterioles, and these arterioles forms capillaries. Here where the nutrient exchange and oxygen exchange takes place. And these capillaries are formed into venules, and these venules form superior veins. So this is a cycle. Here you can see these are the locations of the heart where this particular action takes place. Step 1 is where right atrium receives blood from 3 veins: superior vena cava, inferior vena cava, and coronary vena cava. I am not repeating it, just go through it. After discussing that, all of you might have one doubt regarding the arteries and veins. Let us see 2 statements. All arteries carry oxygenated blood. Is it true? And all veins carry deoxygenated blood. Whether the 2 statements are true or not. It is true only for 90%. These statements are true only for 90% except in pulmonary artery and pulmonary vein. Majority of the arteries carry oxygenated blood, and majority of the veins carry deoxygenated blood. Except pulmonary artery and pulmonary vein. This scenario is reverse in case of pulmonary artery and pulmonary vein. Remember, veins always carry blood towards the heart, and arteries always carry blood away from the heart. I am talking about pulmonary and systemic circulation, not about coronary circulation, because coronary circulation, in case coronary arteries, they need to supply, that is an entirely different network. Coronary circulation is entirely different. Coronary arteries, they supply blood to heart. In that case, those arteries, they supply blood towards the heart. But in general, arteries in pulmonary and systemic circulation, they carry blood away from the heart, and veins carry blood towards the heart. And 90% of the veins carry deoxygenated blood. For that reason, veins are given with blue color and arteries are indicated with red color, except pulmonary artery and pulmonary vein. in previous pictures also, if you might have observed, the pulmonary artery is in blue color and pulmonary vein is in red color. The reason is pulmonary artery contains deoxygenated blood. The pulmonary artery contains deoxygenated blood, whereas the pulmonary veins contain oxygenated blood. The pulmonary artery supplies deoxygenated blood to lungs. Lungs are the place where gaseous exchange takes place and deoxygenated blood is converted into oxygenated blood. And from lungs, the pulmonary veins carry oxygenated blood to left atrium. The left atrium receives blood, oxygenated blood from 4 pulmonary veins. The pulmonary veins contain oxygenated blood and pulmonary arteries contain deoxygenated blood. Please remember this point. Now coming to the conduction system of the heart. We will briefly discuss about the conduction system. We are not going into details. So, what is the function of the conduction system? The conduction system ensures that the chambers of the heart contract in a coordinated manner. The conduction system ensures that the chambers of heart contract in a coordinated manner and the entire circulation process takes place. So, what is the first step of conduction system? Here in the right atrium, you can find sinoatrial node or SA node. SA node, it has orthorhythmic fibers in the SA node. It is located in the right atrial wall and it acts as a heart pacemaker, initiating cardiac action potential. So, which is the place where cardiac action potential is initiated? That is the sinoatrial node. Sinoatrial node has orthorhythmic fibers which initiates the cardiac action potential. This cardiac action potential propagates the entire conduction system. So there is a stepwise, the steps through which the cardiac action potential passes. First it gets initiated in the sinoatrial node, which is also called as natural pacemaker. So what is the pacemaker of the heart? SA node or sinoatrial node, and it is located in the right atrium. The conduction system occurs, first step is sinoatrial node. Through sinoatrial node, the action potential or the cardiac potential, it passes to atrioventricular node. From there, it passes into atrioventricular bundle of His. This is the atrioventricular node. From the atrioventricular node, it passes into bundle of His. From there, it passes into right and left branches, and from there, it passes into Purkinje fibers. This is the order of the conduction system of the heart. Sometimes you may get a question regarding the order. So please remember the order. Sinoatrial node, then atrioventricular node. From that, or atrioventricular bundle or bundle of His. From there, right and left bundle branches, and finally to Purkinje fibers. Now coming to the clinical significance, let us briefly discuss about what is stenosis and what is insufficiency. Narrowing of heart valve opening that restricts the blood flow is known as stenosis, and failure of a valve to close completely is termed as insufficiency or incompetence. Now let us see a condition. In mitral valve stenosis, a scar formation or a congenital defects causes the narrowing of mitral valve. And one cause of mitral insufficiency is where there is a backflow of blood from left ventricle into left atrium. With the help of mitral valve, blood flows from left atrium into left ventricle. But because of the insufficiency, there might be a backflow. That is called as mitral valve prolapse. That is a common condition, MVP, mitral valve prolapse. In MVP, one or both cusps of the mitral valve protrude into the left atrium during the ventricular contraction, and the mitral valve prolapse is one of the most common valvular diseases affecting as much as 30% of the population, and it is more prevalent in women than in men, and it does not usually poses a serious threat. The next stenosis is aortic stenosis. Here the aortic valve is narrowed, and in aortic insufficiency there is a backflow of blood from the aorta into left ventricle, and certain infectious diseases can damage or destroy the heart valves. One example is rheumatic fever, which is an acute inflammatory disease that usually occurs after a streptococcal infection of the throat. The bacteria trigger an immune response in which antibodies produced to destroy the bacteria instead attack and inflame the connective tissues of the joint, heart valves and other organs. Even though rheumatic fever may weaken the entire heart wall, most often it damages the mitral and aortic valve. And if daily activities are affected by symptoms, and if a heart valve cannot be repaired surgically, then the valve must be replaced. Tissue valves may be provided by human donors or PICCs. Sometimes mechanical replacements are also used. In any case, valve replacement involves open heart surgery, and the aortic valve is the most commonly replaced heart valve. Now let us briefly discuss about blood pressure. The contraction of ventricles generates the blood pressure. The hydrostatic pressure exerted by blood on the walls of a blood vessel. What is blood pressure? It is a hydrostatic pressure exerted by blood on the walls of a blood vessel. And the blood pressure is determined by cardiac output, blood volume and vascular resistance. And BP or blood pressure is usually highest in the aorta and large systemic arteries. Usually in a resting young adult, BP rises to about 110 mmHg during the ventricular contraction and drops to about 70 mmHg during a diastolic. During the systole, it may rise up to 110 mmHg, that is called as systolic. And during the diastole, which is nothing but ventricular relaxation. Systole is ventricular contraction and diastole is ventricular relaxation. And the systolic blood pressure is the highest pressure attained in arteries during systole, and diastolic blood pressure DBP is the lowest arterial pressure during the diastole. Usually the BP, that is 110/70 or 120/80, is nothing but systole by diastolic blood pressure. Systolic is 110 mmHg and diastolic blood pressure is 70 mmHg. Next, what is pulse? Pulse is the alternate expansion and elastic recoil of an artery. Alternate expansion and recoil of an artery wall with each heartbeat. It may be felt in any artery that lies near the surface or over a heart tissue. A normal resting pulse is 70 to 80 beats per minute. And what is blood pressure? As we have discussed earlier, it is a pressure exerted by blood on the wall of an artery when left ventricle undergoes systole and then diastole. When the left ventricle undergoes systole and then diastole. First the contraction occurs, then the relaxation. It is measured by a sphygmomanometer. Next, systolic blood pressure. SBP is the arterial blood pressure during the ventricular contraction, and diastolic blood pressure DBP is the arterial blood pressure during the ventricular relaxation. And what is pulse pressure? Pulse pressure is the difference between the systolic and diastolic blood pressure. It is normally 40 mmHg. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.